And then we can cut this, right?
Yeah, we can.
Okay, hi, I'm Haley Adamy.
I'm Drake Carr.
And I'm Adam Everett, and our assigned body system is the endocrine system.
Hunter's a 21-year-old college basketball player who began experiencing unexplained weight gain, especially in his face, gastric region, and upper back. Over several months, he also noticed myasthenia, acne, especially on his face and thoracic region, and ecchymosis on his gastric region. His performance during games began to decline because of constant asthenia, psychological changes, frequent cephalalgia, and slow healing from minor trauma. Concerned about these ongoing problems, Hunter went to the campus sports training room.
A physical checkup and lab work showed hypercortisolism and problems handling glycemia. His fasting blood glucose was elevated, and he had signs of insulin resistance. He also had hypertension and hypokalemia. A detailed cephalogram revealed a small benign growth on his pituitary gland.
Further endocrine tests confirmed hypersecretion of adrenocorticotropic hormone. Hunter was diagnosed with Cushing's disease, a type of Cushing syndrome that happens when hyperpituitarism occurs, causing the adrenal glands to make too much cortisol. In some people, this condition comes from taking corticosteroids for too long, but Hunter wasn't taking any. Doctors recommended a transnasal craniotomy. After surgery, he needed hormone medicine and physical therapy to help rebuild his strength. He was also prescribed antihypertensive medication to manage his blood pressure and calcium supplements to prevent osteoporosis. His recovery plan included eating foods low in salt and sugar and high in protein, regular checks of his blood pressure, and osteodensitometry to monitor for osteoporosis.
He also had monthly follow-ups with an endocrinologist to track hormone levels and adjust medications as needed. To support his mental health, Hunter attended therapy for anxiety and received ongoing psychotherapy. Hunter found much support through his faith. Having been raised in a Christian household, he leaned heavily on scripture and prayer during times of fear and limitation. A particular verse, Jeremiah 30:17, "But I will restore you to health and heal your wounds, declares the Lord," served as a guiding affirmation that brought him peace of mind during this healing process. Along with this, he started going to weekly meetings with his pastor to help strengthen his faith during this time. These things all helped with his spiritual well-being, essential to holistic healing. Hunter leaned on his faith and team support system throughout the healing process. He joined weekly meetings with a student faith group and found comfort in group prayer with his teammates. He also explored holistic therapies such as guided meditation, diaphragmatic exercises, and journaling. The support from both his spiritual community and sports team gave him encouragement and strength. After months of recovery, Hunter was able to begin light training again, and with continued support and care, he focused on returning to full health in sports.
Hunter's case demonstrates the effective process of a long-term integrative care approach, along with spiritual and holistic well-being. It presents an effective approach of evidence-based endocrine healthcare paired with emotional and spiritual wellness.
All right.
Good job.
That's
guys.
it.